My name is Dr. Buonassisi, and I'm a board-certified facial plastic surgeon with a practice in Vancouver, Canada. I've been specializing in cosmetic rhinoplasty for almost 20 years, and I'm here to answer your questions about this very interesting procedure. Happy patients are educated patients, and that's why every question is a good one.
So in one of our earlier videos, we talked about being a candidate for surgery. One of the factors is whether or not the benefits from having surgery would be worth the risks. And I think in situations where someone has a very normal nose, but perhaps one feature that they don't love, sometimes trying to change that feature exposes them to the same risk as someone who has significant abnormalities to their nose. And I often wonder if it's really worth that risk. In one of our previous videos, we talked about candidacy for surgery. And that's really my job as a rhinoplasty surgeon to decide whether or not you are a good candidate. For example, all surgeries have risks. Now, of course, with rhinoplasty, there's lots of benefits from rhinoplasty as well, but if the benefits are very small and the risks are still fairly high, I don't think that's a good situation to consider having surgery in. So for example, if you had a very small irregularity on your nose that isn't necessarily obvious, but maybe just bothers you, I'm not sure that having surgery just to make a very small change to the nose would be worth the risk. However, if you have a very unusual nose or very abnormal nose, perhaps a very masculine nose on an otherwise very feminine face, sometimes the amount of change that can be achieved with rhinoplasty is quite significant and would be well worth the risk. Even though risks are small, they're still there. And I think the most common risk with rhinoplasty is that your nose may look different, but not necessarily better. And we really want to try and choose patients for rhinoplasty who are unquestionably going to have a nicer looking nose with surgery. So think about that long and hard. If you want to make a change to a feature that's almost perfect already, do you really need to do that? And is it really a good idea? Chances are it's probably not. If you really feel that you want to have a rhinoplasty and you're not sure that you're a candidate, have a consultation with an experienced rhinoplasty surgeon. Just be open-minded to the possibility that your surgeon may not suggest that you have surgery and may think that you're not a good candidate. In our practice, we have a pre-consultation where we assess, we get a preliminary assessment on patients and as to whether or not they're candidates for surgery. The reason we do this is that we have more inquiries for rhinoplasty each day than I can physically see. And what I'd like to do is at least let people know in advance that it's unlikely that they're a candidate for surgery based on the photos that they've sent and what their goals are from surgery. So during a pre-consultation, if we determine that we don't feel you're a good candidate, please understand that we're trying to provide you with good service and honest feedback. And keep in mind, if a surgeon feels you're not a candidate for surgery and says no to your request, chances are they're doing you a very big favor.
Thanks for listening, and check back regularly for new questions and my honest answers about rhinoplasty.